really hope Niger could be with us is that she is, looking at this work for our employees as well. So Niger, thank you for being with us.
Oh, sure. Thank you. Very glad to be here.
We've heard great things. And I know that, in the future, when some of this settles down, I'd love to kind of participate in some of the groups that you do.
Yes, that would be wonderful. We just inundated by the moment. I guess there's no other way to describe that. We wanted to create some transformative space for our employees to acknowledge, I think, where we are. There was a lot of conversation about being resilient, and that's true. But a lot of it is also just being mindful of where we are and what we've experienced.
Right.
And really trying to connect and find ways that we can get more information to our employees just across the board and just open up two-way communication and hear from them. So that's what gave birth to the dialogues that we've been hosting.
I think mindful it's one of the words that keeps coming up as a takeaway from this time.
Yeah.
I know that was from the time that I was doing kind of social media lives about my COVID experience. I was talking about how it really forces you to be mindful, the pandemic, just whether it's touching your face or, but then there's so many other obviously relevant use cases for the word. So we talked about it in our faith panel and the whole nine. So.
Yes, it has been just a moment in time that has truly stretched us. I think in our last dialogue that we had, we just talked about just how much we're expanding
I like that.
in ways we've never before. So yeah.
I like the way you put the expansion. Yes.
We are live on YouTube. Just wanted everyone to be aware of that. And so want to go ahead and let everyone be aware of that, and we can go ahead and get started. And I just want to thank everyone for making time for this tonight. I'm very excited about this conversation. I'm Jessica Corbett, Director of External Affairs for Fulton County, and we've had the pleasure of working with the Black Cross this year on this really important work and campaign as part of our response to the pandemic. We're excited about the information that's going to be shared tonight. I'm going to be quiet and allow the experts to speak and share their findings and talk about the campaign. And then I will come back at the end to help facilitate Q&A. And I'll turn it over to the Black Cross team at this time.
Good evening, everyone. My name is Andrea Villa, and I'm part of the amazing group of people working in the Black Cross, developing this campaign you're going to see today.
Hello, everyone. I am Dr. Seattle Wallace. I'm a psychologist and researcher working with the Black Cross, and I'm really, really excited to be here today and to learn and share with everyone.
Thank you. So I'm Gail Brooks, and I am the founder and principal strategist of the Black Cross. And before we jump into Alive and in Color, just wanted to give you just a little bit of background. We are a whole health consultancy, and we work in 3 ways to really close the equity gap in whole health. And when we say whole health, we mean mental, physical, financial, social, and community. So we work to really restore trust and reimagine futures. We know that trust is a huge issue when we're talking about communities of color and health-related interests. We work to expand access to critical care, information, resources for our at-risk groups and marginalized communities. And we work to elevate voice and empower agency through racialized data, which we know is a huge gap, as well as community mobilization and engagement. So I'm going to ask my colleague Andrea to move to the next slide so I can dive in. Okay, so Alive and in Color, we are a movement for the community, by the community. Our community-based COVID outreach initiative really targets at-risk communities of color by engaging trusted influencers, advocates, and allies to meet them where they are. We do have some tactics that are direct to resident, as we might say, but really for this phase of our work, the core strategy is about engaging the influential organizations and individuals that are serving these communities every day. The key messages of the campaign are simple but smart. We have this same framework for all of the issues that we address. The first piece is train. For COVID-19, it's about practicing the 3 W's primarily. So that's wash your hands, wear a mask, and watch your distance. Test, which is obviously for COVID-19 to get tested for COVID-19, as well as to get a flu shot. And then treating, and more specifically, treating early. We know a lot of the casualties that we've been experiencing in communities of color are related to delay in getting care. And so part of our focus is to really get people connected to that care so that they can get treated earlier and take advantage of the barrier-free care and resources that are offered by Fulton County and their respective partners. Next slide, please. So when I say at-risk targets, these are the 5 groups that I'm referring to. They are the elderly, the isolated elderly more specifically, urban youth, our at-risk workers who are really frontline workers and essential workers. Also includes a large slice of our lower income population for who might be on Medicaid. African American and Hispanic women, gatekeepers. So a lot of those women are moms. We know that they're very influential across generations as well as subgroups within the community. And then finally, the homeless population. Next slide, please. Great. So this is what we like to call our plan on a page. It's an eye chart, but if there's interest, we can certainly send this information out to others. So I wanted to start kind of from the bottom up, explaining how we approached this initiative. So really the COVID-19 advocacy toolkit was what we like to think of as the backbone of the campaign. It contains all of the key messages for our at-risk groups and the stewards and community stakeholders that will be delivering the information to them. It's inclusive of a playbook, which is quite robust and available for download, and conversations, guides that are customized for each of our at-risk groups. In order to build this playbook or this advocacy toolkit, we conducted robust research across 3 areas, both quant and qual. So we did stakeholder interviews with community stakeholders. We did a Qualtrics survey, which my colleague, Dr. Wallace will take you through. And we are also partnered with the University of Pennsylvania, and we have been monitoring the Twitter conversation, the COVID Twitter stream of about 17,000 Fulton County residents to understand changes in psychological well-being. And that same technology is being used by the state of Washington, as well as the state of Colorado to do the same. And it's included in their weekly situation reports for COVID. Our community outreach involved partnership development with existing partners, as well as new partners with Fulton County. We partnered with them to join our member community so that we can engage them on an ongoing basis. And they will also be kind of the key points of contact for our at-risk residents. So we are holding them to download our playbooks and our advocacy toolkits. All of this work, the content and everything will be housed or centralized at a branded destination, aliveandincolor.com. It is live, thankfully. Finally, it's been a labor of love. We're still working on some bugs, so don't judge us too harshly, but it does have quite a bit of information in one place. And we hope it's information that we worked really hard to make accessible to the people who need it the most. So that information includes, excuse me, Green Book of Care and Resources, which is really kind of the front end of our community-based organizations that power that. So all of the partners are featured under categories such as food assistance, job and career assistance. So whatever the issue you might be trying to address as it relates to the pandemic, we've got resources for you there. Candid Conversations is a series of 8 community-based conversations where we paired key experts in the medical field with influencers. So those might be DJs from V103, or it might be, you know, our trusted leaders, such as leaders of organizations like Hosea Helps, Coalition for the People's Agenda, Ms. Helen Butler, those types of really important people who are doing the work on the ground and serving our targets every day. Social media toolkit so that we can all spread the word and speak out, which includes a meme generator. COVID-19 advocacy toolkit that I just mentioned earlier. And then of course, we want to highlight the partners who have really worked hard to make this possible. Fulton County and the Fulton County Board of Health being primary in that regard. And then finally, that bucket of restoring trust and really engaging our audience is about culturally competent content and communications, right? And if no one actually knows that you've created the content, what good is it? So paid media amplification was paired with that. So that content includes the conversations, it includes the platform, but it also includes on-air interviews that we had with key stakeholders for on WAOK and V103, influencer engagement of some of our local community influencers and leaders, and then paid media in the online and digital space as well. Next slide, please. Thank you for indulging me in that. Okay, so now I'm going to turn this over to my colleague, Dr. Wallace, who will take you through the beginning parts of our findings as it relates to the Circle of Trust survey.
Great, thank you, Gail. That was very informative and, you know, exciting to see all of that on one page. So I'm going to talk a little bit about the survey that we decided to do. We decided that it was really important for the campaign to not just sort of generate creative ideas based on our own inclinations or maybe even past expertise, but we really wanted to make sure that the survey was something that would be giving the voice for the community. So we conducted a survey with Fulton County residents, and it was an online survey that was conducted this past fall. So, you know, very recent in terms of people's experiences and people's behaviors and their understandings around COVID. And what we decided to do was make sure to reach out to Fulton County residents online. And we got responses from individuals from all parts of Fulton County and many different racial groups. If you could go to the next slide, that would be great. And you can see here, though, that we are reporting responses from African-American and white respondents. And that is because even though we did get responses from people from all different racial groups, the numbers were not large enough for us to be able to report what was found from those particular groups. So we're keeping our reports to African-American and white responses. And then you'll also see that we've pulled out percentages and responses from African-American women, because as Gail noted, African-American women do tend to be the gatekeepers of information, of assistance and support for our communities. So we wanted to make sure that we were identifying some of the unique needs and perspectives from that population as well. So our survey was to better understand some of the ideas that the community had around COVID-19 and what could be very useful for them in terms of information. But we also wanted to make sure that we grounded it in the science. So we made sure to incorporate theoretical frameworks that public health have used for decades to basically help to improve health outcomes and improve people more likely to get testing in other types of health issues. And that includes the health behavior model, theory of planned behavior. And then because we're working with communities of color, we wanted to make sure that we also included an ecological systems theory that really built in understandings about culture and social context. So our population, as you can see, was 64% white and 36% African American. And today we're really going to focus in on the responses for the African American population, really looking to provide comparison with the white population so you could see the stark differences in terms of experiences and some of the cultural context with that. If you go to the next slide, that would be great. So what did we find? So much information. One of the main things here is that you can really see from the responses and the results that this pandemic is really heightening the syndemic that we've been seeing in public health for many decades now. And a syndemic is basically the idea that you have multiple issues, multiple epidemics really colliding in communities at one time, making them very vulnerable to health issues. And you can see here from our responses that with COVID-19, there have been a lot of economic stressors, and they are heightened because of COVID-19. If you go to the next slide. So for our respondents, we asked them to talk a little bit about their employment and how it has changed since COVID-19. And you can see from our results here that the white respondents were employed 77% of the time. African-American respondents were 37%. So that's a huge difference in terms of full-time employment. And we can still see also disparity again when it comes to who has experienced a loss or shift in their employment status since COVID-19. 16% of African Americans compared to 6% of non-Hispanic whites have lost their job due to COVID-19. And African American women in particular also noted that they had to quit their jobs because of caretaking responsibilities. And these responsibilities are specifically due to COVID-19. So we have here a heightened level of employment loss, employment shifts, decreases in economic viability for African Americans due to COVID-19. If we go to the next slide. So that, along with all of the racial tensions that we've seen over the last couple of months, has really created an environment or a feeling amongst our participants of fear around job loss, particularly for our African American population. 20% of Fulton County residents said that they feared a loss of income due to COVID-19, and including participants listing that they were fearful of medical bills because of COVID-19. And for African Americans in particular, there was also the idea that they felt that their particular racial group were much more likely to lose their job because of COVID-19. So that is the added stress of not only experiencing shifts in employment, but also perceiving that this was going to happen, even if it hadn't happened already. You can go to the next slide. So we have the economic anxieties, we have the actual job losses, and then we also have the stress that has been experienced by so many people because of COVID-19, when you have the social distancing recommendations, which cause a lot of isolation for people. There also is the emotional stress of grief and loss that people have experienced with hospitalizations and deaths of family members. And so mental health is a significant concern for our Fulton County residents. And in particular, we see here that African Americans, over 70% reported emotional distress from COVID, and over half reported a mental health issue within the past week that they took the survey. So you can see here 56% stating that they had high levels of anxiety in the past week due to COVID-19, 50% for depression, 52% for loneliness. And again, this is all around COVID. And one particular thing to note that we saw in our findings was that African American women were reporting as a whole that their mental health was not negatively impacted by COVID. So that was a separate question that we asked everyone, overall, do you feel like your mental health has been negatively impacted by COVID-19? And you can see that African Americans, 28% said that, that they weren't negatively impacted, 17% for whites. So you can see that the majority of people felt that they were impacted, but African-American women were much less likely to feel impacted. And what we are unpacking here is that we believe that this is much more about a perception of needing to fit with the expectations for African-American women around strength and resilience and lack of vulnerability than it is for the actual reality of not having mental health concerns. Because when we broke down the questions and asked specifically about anxiety or depression or loneliness, the rates were much higher. And so the implication we have for this is that we definitely need to prioritize messages for African Americans, because you see 70% are reporting emotional distress. But there also needs to be some tailoring around messaging, particularly for African American women. When you just generally talk about mental health, it's not resonating. So we need to maybe make it much more specific to talk about issues that are much more relevant to the real lived experiences, like caregiver stress, like fears around job loss, so that it's something that they're able to connect with. And I think that that is something that we're really looking to see here. It seems to be an implication that we really want to address with the rest of the campaign. Go to the next slide. So in addition to the very high levels of mental stress that people are experiencing, we do have a number of individuals here who had never heard of, and they were not aware of, the free mental health and behavioral services that Fulton County offers. And so there seems to be a gap here and a wonderful opportunity for Fulton County to be able to provide and serve the community with these resources. So amongst our African-American residents, there were 36% were aware of Fulton County free mental health services for adults. And so that's a very low rate, but 60% interested. So that means that there really is a chance for many individuals to be served. One other thing that we also found was that the rates for being interested in services for children were much lower. And we believe here that in terms of an implication, that it really could mean a place for education around why mental health services and behavioral services would be needed for children. And not only in terms of just generally, but specifically also around COVID-19. When you think about all of the stress and things that the children are experiencing right now, there would definitely be a huge need for that. So this is a great opportunity, we believe, to prioritize the services that Fulton County offers around behavioral health services to residents, and in particular to provide messaging around children's emotional distress so that they can get linked to those resources that are available. You can go to the next slide. So what else are we finding? COVID-19 knowledge and behaviors, if you go to the next slide. There was a pretty high level of individuals feeling like there were alternative health behaviors that would help to prevent COVID-19 infection. And their participants were listing things like prayer, diet, exercise, immunity boosting, yoga, deep breathing, taking herbal tonics, you know, and we're talking about high percentages, you know, in the 69%, 78%. And these were things that individuals were feeling were very effective in helping to prevent them from COVID-19. And so one of the things that we think is important is that you don't want to ignore, or you don't want to dismiss or diminish the behaviors or these practices that individuals have. But I think it's really important as public health professionals that we really do think about engaging our scientists and our public health professionals in these conversations around alternative behaviors, so that they can be educated around where these behaviors would make sense or are beneficial around COVID-19, and when we also need to take extra steps around COVID-19 that are much more based in the medical model. In addition to these alternative behaviors, we also found the great news is that individuals were having very high levels of preventative behaviors, including wearing masks, including social distancing, et cetera. But there were some other behaviors that they were practicing, which we want to be aware of and probably make sure we lower, including hugging and kissing others outside of the home, shaking hands and giving pounds to people. And we're talking about a third of people that are doing that regularly. And that's another thing that we believe in terms of implication, really trying to educate people around decreasing that in public. If you go to the next slide. So there's been a lot of conversation in the media all around about the risk for COVID-19 and how many people are at risk, are susceptible, are passing away, including in communities of color. And I have to be honest with you, when I saw these numbers, I actually had to do a double take a couple of times because I was unsure, wow, I cannot believe this. This is really something else that after all of those messages, a lot of individuals are still believing that they are have a low risk for getting COVID and also a low risk for being hospitalized and from dying from COVID-19. So for African-American respondents, much, much more likely to report that they did not feel that they had a chance of becoming infected with COVID-19. So you can see here that 67% of African-Americans compared to 46% of whites felt that they would be at low risk for becoming infected with COVID-19. 89% believed that they had a very small or no chance of dying from COVID-19 compared to 68% of whites. And again, this really does bring home the message that we need to be really educating our Fulton County residents around susceptibility, because it does seem that individuals are not aware of that susceptibility at the rate that they should be. And so having the tools that we will be having that we currently have around risk and assessing risk is going to be really important here. You can go to the next slide. Also, an area that is a gap in terms of knowledge and education is around the symptoms around COVID-19. 83% of our respondents were unable to identify all of the COVID-19 symptoms. So that is a high majority of individuals. And 30% were unable to identify even half of those symptoms. So things like fever, cough, difficulty breathing, chills, headaches, sore throats. These were things that individuals, a large amount of individuals were not able to identify as symptoms of COVID-19. And 22% of African Americans were also in that group in terms of unable to identify the symptoms. So we really need some education here in terms of helping residents really understand the full spectrum. And it is a lot. There are a lot of symptoms and they fall in many different categories in terms of physical and also emotional and health issues. But I think it's really important that we provide our residents with that information, and the campaign is doing that. So featuring long hauler stories to help also individuals understand not only the symptoms, but the long-term impact that COVID-19 can have on people's health. In addition to a lack of knowledge, we also had lower testing rates. And so this kind of makes sense that if individuals don't feel that risk, they don't really know what the symptoms are, they don't quite fully understand susceptibility, they're not testing. And so we have 90% of African Americans saying they want to take a test, they're willing to take a test, but only 55% had actually been tested. And the key reason those who had not been testing stated that was they didn't feel sick. And so there is a misunderstanding there around, when someone can become infected with COVID-19 and, what symptomology is associated with that. And that's a definite area in terms of really trying to educate the public more on asymptomatic or pre-symptomatic transmission, so that people can understand that you should just be getting tested regularly, particularly if you are in a high risk group as an essential worker or high risk in terms of medical risk for COVID. And 40% of African Americans believe that the COVID test would help them stay healthy. So that's a very low number again. And so again, really trying to help individuals understand where testing fits in terms of the healthcare status, and helping people really understand that process.
Thank you, Dr. Wallace. So I'm going to pick up where she left off, and I'm going to try to speed through here a little bit. So you'll see this section is called the cloud of distrust, right? That's driving African-American attitudes. And, you know, we've known that African-Americans, and forgive me, I keep looking up at the big screen. We've known that African-Americans have struggled with trust when it comes to healthcare and medicine forever. And when you consider the cultural context, rightfully so. But we really wanted to set out to understand the key areas, right, where distrust is acting as a barrier to COVID risk mitigation, and how we might address these issues in our messaging. Next slide, please. So fatalism and the infodemic. I'll start with the infodemic. So infodemic, for those who may not be as familiar, the term we use to describe the sea of misinformation and disinformation. Misinformation being just incorrect information, which is spread by so many of us on a daily basis, unwittingly, often, and then disinformation, which is actually intentionally spread by what we call bad actors. And what's interesting about what's happening here in the pandemic, and you guys know that bad actors are the same people who are online kind of trying to influence elections and that kind of thing. But, you know, what we're seeing here is that the disinformation and the conspiracy theories are being targeted or directed by these bad actors to both, it's interesting, the same thing, to the anti-vaxxers, to the very, you know, distrustful African-American or communities of color, as well as to the alt-right. And so and all three of those groups are actually engaging in and sharing the same content of mis or disinformation. And unfortunately, some of these theories are taking root. So some of the theories that have taken root that you can see, almost half of African-American respondents, 47%, believe that COVID was developed intentionally in a lab. 41% believe that it's a tool for population control. 24% believe that COVID is connected to 5G still. And 13% of the African Americans who participated in our survey don't believe that COVID exists at all. So we really do have, you know, our work cut out for us, I guess, in terms of kind of engaging this population in what we call the truth, which is part of why one of our tagline is beat COVID-19 with the truth. Religion and faith also came up, and fatalism also came up as a possible barrier, a significant one at that, to understanding risk and susceptibility. Because what we found was that 39% of African Americans believe that COVID-19 is a sign of the end of times. And so when you're thinking in this way, what can you do to kind of mitigate the outcome, right? The fatalism piece is really about, you know, regardless of what I do, it's either my time or it's not my time. So, you know, we've taken this information and we actually began to really engage faith-based leaders in conversation with scientists to really have that conversation and revisit the reconciliation of religion and science. You know, just as there's a reason why we wash our hands, as faithful as we might be. Next slide, please. Government is not to be trusted, not my words, but theirs. So unfortunately, we knew that there were issues around government, but what we found is that it was greater than what we anticipated, because it applies to both the national and the local level. So 25% of African Americans, only 25% completely or mostly trust local governments as a source of COVID-19 information. Other institutions that have similar levels of trust include the state government, President Trump, and Congress. And then 37% of African Americans believe that COVID-19 is a political conspiracy, and about a third believe that it's a secret government agenda. So that was really just confirmation, you know, as to our strategy of really creating a platform that feels for us and by us, so that it could be, you know, help to mitigate some of that distrust. Next slide, please. Racial and cultural congruence. It's a little bit, but I could have probably used a better layman's term there, but basically what we're saying is that trusted provider is a privileged term conveyed to people who look like me, walk like me, talk like me. That, at least for a majority or a large portion of the African Americans that we spoke to or who participated in the survey, indicated that they did prefer to engage with doctors or care providers of color. Nearly half of African Americans and African-American women reported being able to see those care providers, but that means that 50% roughly are not able to see those care providers. And one of the issues that raised that we found in other data points, one of the really concerning issues is that they may be delaying services because of this. So 40% of African Americans and 27% of the women that we talked to reported delaying services due to those cultural concerns. So one of the things that we know that we need to do is to acknowledge this history of distrust that we have in communities of color as it relates to healthcare institutions. We need to connect African American and residents of color to doctors of color and care providers. And we really need to reinforce kind of the accessibility that telehealth services provides. So we don't have to get in to see the doctor physically. We can actually have consultation over our mobile phones. Fear of the black tax again. So in healthcare, African Americans are very conscious of bias. We know this. In fact, when we were monitoring the Twitter conversation around the time of all of the social unrest in around Juneteenth and in July, we saw the conversation shift from COVID-19 all the way over to the racial unrest in the country. And it's impacting, you know, the way that we look at the world, really, right? So the majority of our AA respondents believe that they will receive subpar care because of their race. I think this has been heightened by what we're seeing or going on in the country this year. 64% of African Americans agreed or strongly agreed that people of their race will not get COVID-19 related healthcare that's as good as received by other groups. So again, we've got to acknowledge the cultural context. We have to be truthful and acknowledge the existence of the bias, but we also have to educate on ways to get around that bias and to make them feel comfortable in seeking care that they need. Next slide, please. Vaccine, no thank you, I'll pass. So you've heard the numbers. I think we've all heard the numbers, but I think the numbers have really hovered between, at least in mainstream media, between 40 and 50% hesitancy in terms of I will not take it. Well, the numbers were greater in our survey. So 60% of African-American respondents indicated they are unwilling to take the COVID-19 vaccine versus 15% of non-Hispanic whites. Next slide. So now I'd like to get into the next section, which is really about, okay, so we've got all this information on attitudes and kind of the level of awareness. So how do we really begin to engage these residents? So first thing we uncovered was that the landscape is fragmented, which we kind of know if you work in engaging African Americans and people of color, they tend to consume more media from more sources, and that was not uncommon, or that's actually what we found in the area of healthcare as well, that they are going to more and diverse sources than their white counterparts. They're also going to different sources. So when you look at kind of the most used sources for COVID related information for African Americans, Google, #1, the local news, and then Facebook, #3. But for non-Hispanic white sources, it was Facebook flipped, Google, and then Twitter. So social media is definitely more top of mind, or at least more habitual in terms of where they're going for the information. Another piece of data that was of note, we thought was really of note, is what we found out in terms of pastors and celebrities. So only 4% indicated that they were in kind of the top 3 or visited places in the last week or so for COVID-19, or most used. So pastors and celebrities, we know that they're influential in other areas. We know that they're somewhat influential in the healthcare industry, but we believe that they're more or best used as a channel to broaden awareness that then needs to be supported by other resources. So let's get into that on the next slide. So now when I look at the most trusted versus the most used, what I find is that most trusted is not most tried. So that seems to indicate that there is some issue with accessibility and or relevance. So we have a hypothesis here that we'd like to really unpack with some of our partners in the next round. But despite reporting Google as #1 and Facebook as #3 in terms of top use for AA, they really indicated a greater degree of trust from doctors, #1, and the CDC, #3. Again, we think that they are not as aware, and I think there's a huge opportunity to connect our residents through telehealth services so that they can ask the questions that they want to ask from care providers and get the answers from places that they feel they can trust. And then on the CDC part, we think it might actually be another issue. And we think that might just be the relevance piece, particularly since we're talking to African Americans in the Atlanta area or Fulton County area where CDC actually lives. So there's some top of mind awareness there in terms of, what they do, how they do it, and that they should be trusted. But for some reason, they're not going to the CDC site to get the information. So we think that has to do with kind of how the information is delivered. Another interesting point was that African-American women demonstrated the greatest degree of trust in the information sources, which just kind of reiterated the reason we are positioning them as gatekeepers. If we can get the right information to them, we think that they're more open and receptive to receiving it. And then we also know how influential they can be in getting that information to other subgroups in the community. All right, next slide. So I'd like to land on what we call the journey. So I think in corporate communications, they call it the consumer journey. In public health, we call it the path to patient care. And in this instance, we're calling it the path to patient information and care. And what this really just shows is the funnel, right? So what channels are we using to get information out? What channels are we using to get information to be really considered? So it might even have more detail, or maybe it's more targeted, more specific to whoever it is. And then what channels are we using to kind of seal the deal, which is trust. We call it a conversion if you're trying to make a sale. Well, we kind of are trying to make a sale, which is selling kind of the information and hoping that they will actually take the information and act on it. So you can see that there are some similarities and there's some differences. So when we say African American, which is the top green box, we're being inclusive of African American women as well. So these channels apply to the entire group, right? So for awareness, we know that there's Google, there's Facebook, there's friends and family, but to really kind of start to get that consideration and that intention of maybe acting on it, it's more about the local influencers and then also local news. For women specifically, local news came up first in terms of kind of where they would go more often to get the information. But interestingly enough, 2 channels came up that was not necessarily applicable to the other groups, which was radio. And then this was an aha for me, which makes perfect sense, pharmacies. And so that really kind of opened our eyes in terms of some of the alternative channels that we had not been considering. Radio we've been considering, but it might be even more effective for reaching our gatekeeping target. And then pharmacies, which makes perfect sense since they're already doing a lot of the testing. And we know, I believe, Walgreens and CVS will be partnering to do vaccine distribution as well. So how can we get partnered with those companies to be able to get the right information into the hands of those people who are coming through their doors. And then finally, when you look at the non-Hispanic white groups, you can see that social media is a lot more leveraged. And we saw that earlier, right? Because in the top 3, I believe it was Twitter and Facebook in terms of most used sources. But when we looked at kind of trust, Google rose higher. And so I think, it's about, I'm seeing this information on social media, but when I'm actually considering it, I'm going to go do a Google search, right? and then kind of getting it, driven home by the doctors and the care providers that they trust. Because unilaterally speaking, doctors and care providers rose to the top in terms of most trusted sources. So some of the key implications or takeaways: we need to centralize information across our most relevant channels for each of these audiences, right? Or at least centralize the information that there is a destination where all of it is kind of condensed. And we need to really talk about transmission and symptoms and testing, right? These kind of key areas or knowledge gaps. We need to expand access to culturally congruent doctors for information and care. So, is that a partnership with Black doctors? Is it, a partnership with Morehouse Medical School? We currently are very proud to be partnered with them. And they have been extremely helpful in kind of driving the conversation that we've been having with our community leaders. We need to prioritize AA women, again, for all the reasons. They are, potentially face the highest risks. When you look at the percentages that African American women occupy in terms of our essential worker positions, in terms of our frontline healthcare positions, in terms of caretaking duties, heads of household, extremely influential, extremely at risk, but lower perception of risk. So we really need to prioritize talking to them and getting them to understand the risks that are involved, and then getting them to share that information. And then finally, we need to personalize and we need to humanize COVID-19. So we've known this from, other epidemics. We've known this from, whether it be the HIV movement, the Ebola pandemic in Liberia. Survivor stories play a huge role in terms of compelling action and making it real for people or our audience. So the next round of improvements on our site, which will be forthcoming shortly, will include featuring survivor stories, African American. So we've got 3 here in Atlanta that will be part of the site content, or Fulton County specifically. That will be part of the content, and we hope will help to bring it home for people. One is really quite remarkable. She's a 2-time cancer survivor and a COVID survivor. So looking forward to kind of highlight that story for inspiration and information. So I will wrap that part up, and I will turn it over to Andrea, who will quickly take you through campaign creative, and then we can take any questions.
Thank you so much, Gail and Ciara. Now I'm going to briefly, and I'm going to do it fast so we have enough time for everyone to post any questions that we want to ask. So let me go through this really quickly. To summarize and to connect the things that Gail and Ciara were saying at the beginning, the idea and the creative that we developed was really based on research, but also in this idea of connecting with the communities. And in an era of triple pandemics like we are currently experiencing, important is to connect facts first, true stories, and motivating behavior and change through the facts, being informed, being engaged, being empowered and thriving. And everything that we created for the specifics on the website and the 1-page plan that Gail mentioned at the beginning is based on this specific of positioning knowledge, engagement, and behavior as an inspirational norm. So we, as important as we are talking about a phased approach, we took a livening color in a phased approach. This first part of our development of the campaign was really inspired to collect information and knowledge, to create culturally relevant content, and to connect and build those relationships in the community, build a network of allies. And phase 2, which we currently are moving toward that, is to continue with all those activities, but also drive residents of Fulton County to connect with the brand. And what better way to connect with something than conversations? We all believe in the power of bringing complex issues into a very digestible ways. And we found that conversations and partnering with true key influencers of the community was the way of doing it. So we created and we partnered with the Gathering Spot and created this space for experts and influencers to connect with the community and try to speak about and understand the realities and how it's affecting the communities of color. We also elevated partners and hosts to hosts and panelists. And most importantly, we were able to demystify these complex issues of COVID by talking with people, real people. We are talking about V103's Big Tigger and Kenny Burns, Ms. Helen Butler from the Coalition of the People for the People's Agendas. We talked about with Dr. Frank Jones for the Atlanta Medical Association. So we brought names and they came with the power of their knowledge, but also bringing to the community very specific topics that you see listed here, from civicing safely to minding the mentals and how important it is to really support the community throughout the pandemic and helping them not only with mental, but also economical hardship and pandemic. So yet again, we created this vehicle of connecting with partners and the partners that we trusted the community. And of course, those 8 conversations and all the material that was created in them is located right now and hosted in this branded destination that Gail mentioned at the beginning, aliveandincolor.com. So we invite you to go and see the videos of all the conversations there. And as important it is to connect with, as we did with the Gathering Spot, we also connected with V103. V103, as you saw in the research, radio is a really strong vehicle that our communities are connected and they feel connected to, particularly what we did with V103, the People Station. That was not only on-air radio spots and digital buys, as you see on screen, but also we conducted those in-depth interviews with the community, to include Ms. Lisa Gooden, Dr. David Holland from the Fulton County Board of Health. Connecting with real people, connecting them and hearing their voices was another way of us investing in the community. Moving really quickly so we have more time, this branded destination, we invite you to go and visit, we invite you to go and register, and as Gail said, be kind. We're still in this process of evolution. But the whole idea is to have this central location where people, communities can go and find the care and resources they need. It's organized in compartments because the whole idea is to meet what the communities at risk are, to connect with them, and to incorporate simple behaviors into everyday lives. Everything that is put in this website is to beat COVID with the truth. It's organized. We have caring resources about all the partners that have supported the campaign. Speak out on social, connect with your network, really speak about how you feel with COVID, and is a place also for organizations to register and become advocates, to provide informations that are related to the areas of impact that they help in the communities. And we invite them to download the playbook. As Gail was saying at the beginning, the spine and the core of everything that we're doing in the campaign. So let's talk about this toolkit. The toolkit, it's not only, as you can see, and we're very proud of it, beautifully designed to really grab your attention, but also connect with those faces, those people in the community. It's organized in 5 sections. First, is all about information and education. The second section is about those conversation guides, which are the impactful information that we have found from research about our risk communities. Then section number 3 is to amplify and extend our reach through social media. Section 4 is the Green Book of caring resources that are the medical, food, housing, school assistance that our community can go and find and connect. And then the section number 5 is all the partners that have supported the development of this playbook. And also importantly, not to forget those conversations guides. All of this is, again, available to be downloaded in aliveandincolor.com. As important as it is to connect with the communities in real life, it is to connect with your network of social influencers. We created really powerful visual recommendations to post about being informed, being engaged, being empowered and thriving, because we want concerned citizens, as we are, to show their networks what they're alive and in color. We want them to be armed with knowledge, making smarter choices, and thriving. So that's it. All of this, you don't have to register. You can actually go and download it from the site. And moving to the last piece, we have about 8 minutes, Jessica, to see if we have any questions right now posted in our chat. We have time now or time later to answer any questions, but this is our way of saying, let's stay connected with the community and we all beat COVID with the truth.
Well, as we go into Q&A, I just want to thank all three of you, Dr. Wallace, Gail and Andrea. Gail and Andrea and I have spent a lot of time together over the last several months, and it's really been an honor to be part of, in our small way, of this, and I'm very proud that Fulton County has had a role in this. We do have a few questions in the chat, and I'm going to go ahead and do my best not to butcher them. Niger Thomas had a question about whether you saw different responses in the African-American community based on age, especially about questions on whether and how people are using technology to find information, if those conversations about behavioral health in children in the African-American community, if there's been some historic stigma around that, a taboo. She'd also love to know how to expand this conversation, and especially understanding behavior as a medical condition. And there's a little bit more, but I'll go ahead and let you guys answer that first part first, and then we can move into the rest.
Okay, so I think the first piece was about age, right?
Yes.
So, you know, kind of the differences. Dr. Wallace can probably speak with more certainty than I can based on our sample sizes. The information that we did see I think is directional, but if you please do expand.
Oh, yeah, so there definitely were differences, but in terms of significant enough differences to pull them out, from what we're seeing right now, it's not the case to do that. I think that we decided that it would be best, especially in the interest of this presentation and timing, to report out specifically for the African-American sample as a whole, and then pull out the African-American women because of the gatekeeper role. But in terms of age differences, nothing that we would pull out at this moment in time, but we have lots of data to kind of go through at a later date if there's specific things that needed to be, examined further.
One thing we did see, I think in our first pass, was related to mental health. And it was actually consistent with what we were seeing through secondary research. Younger targets, so youth, adolescent youth and young adults were severely impacted by mental health issues, anxiety, depression, and from what I'm understanding, we're seeing that echoed in suicide rates and attempted suicide rates, which really just reinforces kind of the level of the syndemic that these communities are facing. We also know that there's same issues with substance abuse, in terms of rising, and domestic violence. So certainly a lot to unpack there. And we look forward to kind of digging through the data more so in the future. The next question.
I was going to say, Gail, you could probably just, I think one of Niger's questions was about, toward the end there, was about African-American female burdens associated strength, or how do we speak to that?
How do we speak to the burdens associated? Yes, so that's something that we actually are looking forward to digging more so into in the qualitative, the next round of qualitative, and hopefully partnering with some of our friends over at Morehouse to do so. They're part of the SEAL network, which is going to be going through a very robust study of quantitative and qualitative research as it relates to COVID-19 and vaccine. In terms, there's certainly secondary literature that exists out there in terms of, the superhero complex and, I forget the other term, imposter syndromes and all of those things, those added weights that we put on ourselves that kind of increase the burden. But if I could give you opinions based on kind of my experience, but we don't have evidence directly related to this study that would inform, answering that question. So I don't want to go there. Is there another question?
There is a question. Carlos had a question about youth specifically, and the Circle of Trust. He said urban youth were listed as a target group, but that the Circle of Trust campaign demographic chart began at age 18. Has there been outreach, or will there be, to get input from youth? I think Carlos means younger than 18. Youth have been regarded as asymptomatic characters, which can make them unintentional spreaders without knowing.
Yes.
And also asked about campaign strategies to encourage this age group in the 3 Ws.
Yes. So great points, great questions. So we got secondhand insight around the youth population through interviews with the Atlanta public school system as well as the Fulton County school system. And it was actually quite eye-opening in terms of what, behaviors that they're seeing demonstrated. I think because of the proximity of, let's say, youth of color to some of the devastation that COVID is taking on their communities is actually driving more adoption of risk mitigation behaviors. So kind of counter to what I thought going in, they were seeing more issues in terms of risk mitigation behavior with non-communities of color than with communities of color. Well, I should say that when you look at African Americans versus Hispanics versus non-Hispanic whites, non-Hispanic whites were more likely to not practice the risk mitigation behaviors, as were Hispanic groups. We think we have a hypothesis, even informed by those interviews, that they might be for different reasons why they're not practicing those behaviors. But needless to say, African American or urban youth are actually adopting some of these behaviors. We also are going to, again, tap into the qualitative research that they're doing, which I do know includes those groups as well, over at Morehouse Medical School. So we'd be happy to kind of double back around with you in terms of that information.
Thank you so much for that, Gail. I'm just going to go through. We have a few more comments, but I will, I think we can address later when, Niger had another comment about the issue of discussing mental health for African-American females.
Yes.
If there are no other questions, if anyone wants, let me check and see if anyone has their hand raised. I don't see that. But I just wanted to say thank you all again for making time for this. We were trying to keep it to 1 hour and we're just a couple of minutes over. Any closing remarks from you all before we wrap up?
I would just say, well, first I want to thank everyone. And I did want to just quickly address Carlos's last question in terms of the homeless population, because yes, we are engaging the homeless population more specifically around the institutions that serve them. So the community-based organizations, but we also have a call on the books with the Department of Housing. I think I'm going to mess up the Department of Housing and Human Services. I think it is. Coming up next week, actually, to discuss this very thing. So
I should mention that Carlos works in that department and manages our contracts for one of our programs that is works with many nonprofit groups. So he's a great partner, and Carlos, I will try to make sure you're part of that call.
Awesome.
Possible.
So I don't know if my other colleagues want to say anything, but thank you for indulging us and sharing this a ton of information that we're super passionate about sharing. And it has been an honor. It really has been an honor to work with Jessica and on behalf of Fulton County in the work that we're doing.
Well, I just want to say thank you one more time. This session was recorded. It will be on our Fulton County YouTube page, so we can share the link. I hope everyone who's on the call will sign into the website, download the toolkit, and share this video, because I think there was a lot of great information, and we look forward to continuing, and I hope into a next phase. So thank you all very much, and have a great evening.
Thank you.
Thank you.
Thank you. Happy holidays, everyone.
Happy holidays.
Happy
Thank you.